Welcome, I'm Rebecca Jackson. We're excited to be launching a brand new video series with interviews with the PeopleSoft Innovators. We're kicking things off today with Tony Schollum from Kaiser Permanente. They recently won a PeopleSoft Innovator Award for their deployment of the Fluid User Interface and Selective Adoption, and a Feature Innovator Award for Oracle Guided Learning. Tony talks about what they've done and what they're working on next. For our inaugural episode, I'm so happy to welcome Tony Schollum, Executive Director of Kaiser Permanente's OneLink and Finance Technology Implementation, Governance, and Support Organization. Tony, welcome to the show.
Thank you, Rebecca. Excited to be here.
For those that have heard of Kaiser Permanente, but maybe are a bit less familiar with the organization and your 250,000 employees that use PeopleSoft's ERP products, can you talk for just a moment about your role and what it's like to support an organization that big?
Perfect. Thanks, Rebecca. So first of all, I'm very proud to work for Kaiser Permanente. We are the nation's largest healthcare integrated delivery network. And for those not in the industry, it means that we're both the health plan, the insurance side. We're a provider. We have 39 medical centers and 724 and growing medical office buildings, hundreds of pharmacies, and we also have the physician groups that work together in our network. And we are proud to support and honored to support over 12.5 million American lives as part of that. So to support all of that, again, we're a very largely not-for-profit organization. We have a massive ERP organization supporting our 250,000 users. My responsibility, we support our finance and supply chain PeopleSoft solution, which is, you mentioned, it's called OneLink. And it's a big responsibility. We support it at 4 nines, high availability. We get over 60,000 different user encounters, tickets, Oracle guided learning, which we'll talk about a little later on, to provide that high level of customer experience and service.
And you've been a member of the PeopleSoft community for quite a long time, right?
Correct. Yeah, we've been live now for coming up on 11 years as we phased in our deployment. And additionally, there's another group at Kaiser Permanente that was on the PeopleSoft HR side, and they recently successfully migrated to the Oracle HCM Cloud Application Suite. So we're very excited to see that part of the journey as well for the HR side.
Absolutely. You're a success story in taking advantage of Oracle's options that we provide in terms of how and when customers adopt cloud based on what's right for their business. You're also a PeopleSoft Innovator, and it's so wonderful to kick off our first PeopleSoft Innovators show with you. You rolled out Fluid. One of the things we recognized you as an innovator for was your rollout of the Fluid user interface. Given you have such a large, and I have to believe, really varied user base, from the casual self-service user to the power user, what kind of rollout strategy did you use for Fluid, and how did you manage the change?
Great. So we started our Fluid journey along with our PUMS update journey about 5 years ago now. Wow, it seems a lot longer ago than that. But what we did is for Fluid specifically, we decided to do a pilot. We saw the advantages. We thought it was very user-friendly, but we wanted to just try it out. So at Kaiser Permanente, a pilot is 5,000 users. So we rolled out to those 5,000 users. And it went so smoothly that within 1 or 2 months, we then did a big bang to the other 245,000 users out there at Kaiser Permanente. And it was very, very well received. We went with Fluid homepages. We did the tiles, the nav bar, the nav collections. And then we basically did Classic Plus for everything else, including any of our modifications, customizations.
So what was the end user reaction when you rolled Fluid out to across all of those different users? Did they respond the way that you expected? Was there anything that you got that was a surprise?
Yeah, absolutely. It was extremely well received. So some of the, and this is sort of direct user quotes here, were Fluid is a user-friendly approach to OneLink. Layout is simple, easy to follow. Love, love, love the large font size. So I guess someone had issues with the small font. Navigation is so much easier. The nav bar and the navigator make it so much easier to get around. This is great. When can we start using it? So that was actually from some of the pilot users. Just a lot of great feedback. They love the icons and the tiles, being able to click. And summing it up, Fluid is a user-friendly approach to OneLink, which is what we wanted to hear from our customers.
That's great. I can relate to the person that liked the larger font size. I'm at the point where I'm really squinting, right? Exactly. So one of the things that I love about Kaiser is that as large of an organization as you are, you're never static. You're constantly taking new features, deploying new technologies. And to do that effectively today, you really need a selective adoption strategy. Can you talk a little bit about how you arrived at your selective adoption strategy and what you feel are the most critical aspects of it to be successful?
Great. So as we went from the old approach of being on 8.9 for many, many years, and then we went to 9.2 in 2015, we didn't want to go through that pain again of having sort of 10 years and a lot of organizational disruption. So we partnered with our stakeholder groups. We have regular business process owner group meetings with our key stakeholders. And we decided collectively that for us, annually was the right cycle time, the right cadence to do this. Part of that reason is just the massive testing and regression testing we have to do. We have about 22, depending on how you want to count it, modules of finance and supply chain management PeopleSoft in place. We have 315 interfaces to 118 systems. So we are the lifeblood of finance and supply chain at Kaiser Permanente. And we want to make sure we don't break anything or impact the user experience. So we worked out that that annual testing cycle was good for us to adopt PUMs, to do, if there's a new tools release, a tools release, occasionally a database upgrade, and adopt new features and new Fluid features. And we also heavily invested the last 2-3 years in PTF, the PeopleSoft test framework. And we have now, depending on the year, north of 70% of our system integration test scripts, thousands, automated through PTF now.
That's wonderful. Yeah, test automation is such a critical enabler of being able to be responsive. You know, what's your customization situation? Would you say you're heavily customized? How do you approach your customization strategy?
Yeah, so obviously, like a lot of people, we try and stay as vanilla and as using the out of the box functionality as we can. What we've found historically is in some of the areas, like in supply chain, in pharmacy, we've needed to tailor it to fit the healthcare business. So we do have a number of customizations predominantly in those areas. And then for the upgrade, obviously, we have to go through and do an analysis. And what I love recently, there's been a number of the new features come out from PeopleSoft, from the customer advisory boards, and from your organization, Rebecca, which has really helped us actually start to retire some of those customizations, as well as using things like the page and field configurator and some of the other great features you brought out.
That's great to hear. We've been working really hard to try to make the design of our features more configurable so that those customizations can be retired. So switching gears a little bit, in addition to recognizing you as an innovator for your user experience and your selective adoption work, as you alluded to, you're the first customer that we're aware of that used Oracle guided learning with PeopleSoft, and you earned a Feature Innovator award for that as well. What prompted you to use Oracle guided learning with PeopleSoft?
So as I mentioned, our HR side of the house adopted the Oracle HCM cloud technology, and they're using guided learning as well. And so they came to us early on and said, hey, wouldn't it be great if we could partner and use this real-time help as you do a transaction technology across both finance, supply chain, and HR to give our users that common look and feel. And so we were at that point where we'd just spent a lot of money and time and effort updating our training materials and UPKs. And quite frankly, as we were doing the updates, it was just a big effort to have to keep updating those. And also, we have 2-3 more thousand per month new users and transferred users that we had to try and find a way to train. And it just wasn't economical for us. So what we loved about guided learning is that we could provide users with the same user experience, the real-time help as they're doing a transaction. We use that for probably 95% of our training materials as well. And it just became a great thing for continuous improvement and customer experience for us.
That's great to hear. Real-time help, I think, really is sort of the modern equivalent of the old desk manual concept. Yeah.
Yeah,
So,
and I was just going to say it was interesting because like any change program, you're going to get some people that jump on board with anything. A lot of the people need a little bit of a nudge and then they get it. And then there's some people that still wanted those 90-page guides and manuals. And we had to work with them to really show them the value of guided learning. And only where absolutely necessary would we do some quick reference guides and things like that. But by and large, guided learning is our way forward.
that's great to hear. Now your team, I know, is also exploring another Oracle technology to use in conjunction with PeopleSoft, and that's Oracle Digital Assistant. Can you talk to us a little bit about the pilot that you're doing with conversational interfaces or chatbots and what that looks like?
Absolutely. Yep. So we are in the middle of doing that pilot right now. And we're starting off with doing a couple of things, some delivered and some, I guess, custom. One is we're going to be using the requisition status inquiry that's been delivered and also the expense report inquiry. They are two heavily used areas across our whole user base. And then a sort of custom skill we're doing is a link to our frequently asked questions database of our articles and knowledge base that we've built up over the years. So we're kind of doing a combo. We are right in the middle of that now and working through some security reviews and hoping to go live later this year.
Wow, that's exciting. Are you finding that it's difficult for end users to make the adjustment to a conversational interface or a chat experience in place of navigating the system? Or are they taking to it kind of naturally? What are you seeing?
So we haven't actually gone live yet, but in terms of the pilot, in terms of the program we've done with our team, people are so used to it in their personal lives, whether it's using a chatbot in a banking relationship or a retail consumer products relationship, that it's really no change to them. I'm sure there'll be some who will want to stay on the traditional interface and help desk way of getting help. But for most people, I think they're going to jump on that and use it as another great avenue to save time.
That's great to hear. As you look forward to the next 12 to 18 months, what do you have in your sights?
So one thing we haven't talked about is Kibana, and we're going to be upgrading to Tools 858 in September. And the team's already now evaluating and investigating Kibana and Kibana use cases. And once we do our update in September, we're then going to go full force into actually piloting and implementing some Kibana use cases. So really excited to join the Kibana journey.
That's wonderful to hear. We just recognized our first couple of Kibana innovators. Well, we can't wait to hear what your experience is. I think there's so much opportunity in our team. Every time we turn around, we're like, oh, we could build a dashboard for that. We can build analytics for that.
Yeah, we're excited. And I do want to thank yourself and the whole PeopleSoft team, because the volume and amount of new features that you're delivering quarter on quarter is amazing and basically keeps our organizations on our toes. And we're able to provide new feature options to our user community to keep things fresh. So it's fantastic.
Tony, thank you so much for joining us today and sharing your insights and your story.
You're welcome. It was a pleasure. Thank you.
To learn more about Kaiser Permanente's PeopleSoft Innovator Awards, see their published story on PeopleSoftInfo.com in the Customer and Innovation section. While you're there, submit a nomination for the new features you've adopted. Share your story with the community.